Welcome to our comprehensive guide on intravenous catheter insertion for nurses. Mastering this technique is not just a skill, it's a lifesaver. It delivers life-saving treatments directly into the bloodstream and demands precision, care, and knowledge. Our first step will be gathering all the necessary equipment, which includes sterile gloves, a tourniquet, alcohol swabs, a securement device, a catheter, extension tubing, a transparent dressing, and a sharps container. Next, we will highlight the importance of clean hands, either washed thoroughly using soap and water or sanitized with an alcohol-based hand sanitizer to ensure aseptic technique. In this video, we will guide you through the entire process, from beginning to end, even including monitoring the patient after the insertion. Let's get started. Remember to communicate with the patient, explain the procedure, its purpose, and what they can anticipate during and after the IV insertion. Consent is crucial. Choosing the right insertion site is key. Consider factors such as patient preference, medical condition, and the type of infusion. Common sites include the forearm, back of the hand, or antecubital fossa. Applying the tourniquet proximal to the selected insertion site will make veins more visible and accessible. Choose a vein that is straight, visible, and has a good blood flow. Be cautious to avoid veins that are over joints or valves. Clean the selected site with an alcohol swab using a circular motion, starting from the center and moving outward. Patience is key here. Allow the area to air dry or use a sterile gauze to dry. Next, put on sterile gloves to maintain aseptic technique during the procedure. Hold the catheter at a 15 to 30 degree angle, bevel up. Stabilize the vein below the insertion site with your non-dominant hand and smoothly insert the catheter into the vein. Upon inserting the catheter in the vein, gently aspirate to confirm blood return, ensuring proper placement. Secure the catheter in place using a securement device such as tape or a transparent dressing. Next, connect the extension tubing to the catheter hub, ensuring a secure connection. Use a sterile saline flush to ensure patency and remove air from the system. Apply a transparent dressing or sterile gauze to secure the catheter and insertion site. Finally, record the details of the IV insertion, including the date, time, catheter size, insertion site, patient's response, and any complications. Always monitor the patient for any signs of complications, such as swelling, redness, pain, or infiltration. Now it's time to test your knowledge. What should you use to clean the selected site for IV insertion? Why should you avoid veins that are over joints or valves? What angle should the catheter be held at during insertion? Remember, mastering this skill is all about practice, knowledge, and precision.